Hi guys, welcome to my YouTube channel. I haven't done a lot with this channel since I started, but welcome to my YouTube channel. I haven't done a lot with this channel since I started, but welcome to my YouTube channel. I haven't done a lot with this channel since I started, but welcome to my YouTube channel. I haven't done a lot with this channel since So, not sure how this is going to work out, but we're going to give it our best shot, okay? It's supposed to be live on YouTube right now. And I just want to welcome you to my YouTube channel. I haven't done a lot with it since its inception. It's just been another place that I could put the Purple Stethoscope episodes. So I do host a podcast called the Purple Stethoscope. It's health literacy for everyday people. And if you want to check that out, those episodes are also available on the YouTube channel. Today, what I want to do is share something that I created actually way back in January, which seems like it was years ago now. This is a primary care course. It is probably one of the most important courses that I've ever done. It's something that is maybe not the most exciting thing in the world, but it's so important. Right now, we are dealing with the COVID-19 pandemic, and there have been some recent developments, as data has been shared, that Black and Brown people are dying at higher rates from this viral illness. There are a lot of different schools of thought for why that is, but I want to focus on establishing care. I want to focus on having a healthcare team, an advocate, somebody that you can reach out to if you have a question without having to jump through tons of hoops. Now, there's hoops to jump through in the beginning when you're establishing care, and I'm going to walk you through that. Matter of fact, let's just get to it. Now, the aunties are out here trying to use this technology. We're out here training ourselves during this, what do you call it? Sheltering in. And this is me training myself. So here's the course. I'm going to go ahead and play it. I did do voiceovers for the course, so I don't have to talk on top of talking. But if I do want to interject something, you may hear me chime in. And welcome to Divinity Health and Wellness Academy. My hope is to put courses as I write them in this format or a similar format and share them with you all. I've got one so far. Let's get to it. From this point on, when you all see or hear the words primary care, I want you to think of them as your partners in healthcare, okay? Your primary care. So let's get to it. Hello and welcome to the Divinity Health and Wellness Primary Care course. My name is Devin Nixon, and I'm going to be taking you through this course. I have a Master of Science in Nursing. I'm an advanced registered nurse practitioner and board certified family nurse practitioner, which is what all those alphabets after my name there mean. This may be the most important course I ever put out, and for that reason, I'm making it available to everyone. I'm going to walk you through step by step what primary care is, who needs primary care, how to access primary care, and how to even save on some of the costs of care. So do me a huge favor when you're done going through the course yourself. If you find it helpful, if you find it useful, please share it with anyone and everyone you can think of who would also benefit from this information. Let's get started.
From this point on, when you all see or hear the words primary care, I want you to think of them as your partners in healthcare. Okay. Your primary care provider, as we'll go through in a second here, can be any number of different healthcare providers, but the primary care provider that you select is your personal partner in healthcare. You may ask yourself, why do I even need a primary care provider? Who needs one? Every single person needs a primary care provider. We help people from the time they're born until the day they take their last breath to stay healthy. Prevention is the major focus in primary care, and health maintenance, of course. So some people may say, I'm healthy. Why do I need a primary care provider? Because we want to help prevent you from developing diseases that plague your family and plague our culture. So, preventative health would be things like helping you learn what your blood pressure is, what your cholesterol numbers are, what's a healthy weight, how to get there and how to maintain it. We'll look at your family history and see what kind of illnesses run in your family or are common in your family, and come up with a care plan or a plan of care to help prevent you from falling victim to the same things. There's also times when we get sick. It's not urgent, it's not emergent. You don't have to go to an ER, you're not bleeding out, but you may want to know what's the matter, why you're having certain symptoms like abdominal pain after you eat, or maybe you've developed an itchy rash, or things like that. You don't want to go to the ER where you're going to get a bill for hundreds of dollars, have to wait around for hours to be seen. Just call up your primary care provider's office and make an appointment. Follow up is another really important reason that people need to have primary care providers. If you are diagnosed with an illness, you want to be following up with someone regularly to make sure that it's not progressing really quickly, to make sure that you're on the right care plan, that the meds that you're taking are working well for you and not causing a bunch of adverse effects. So, follow up is another really important reason that people need primary care. And then, of course, referrals. You may need to be referred to a specialist for certain types of things. There's so many different specialties. You guys probably know, if you listen to the podcast, that I love cardiology and work in cardiology. That's a specialty that requires a referral to see us. And that's when you have a problem that goes beyond the scope of your primary care provider. So, those are all really great reasons why you should be linked up with somebody, and I'll show you how to do that. So PCP is for an acronym, primary care provider, or your personal primary health care provider. You may hear or see that acronym PCP all the time. You may even be in a visit with a specialist or at an ER, and they say follow up with your PCP. Well, if you don't know what that is, or if you don't have one, that statement really doesn't make any sense. Your PCP is your primary care provider, and there's several different types of degrees and licensures that can serve in that role. There are nurse practitioners like myself. There are physicians, physician assistants, naturopaths, doctors of osteopathy, and really, from a patient perspective, the most important thing is you find someone that's a good fit for you, someone that you're comfortable working with. We all definitely have different levels of education, but we all know our scope of practice and when we need to reach out to collaborate with another provider, be it a specialist or someone else on our team. So, Your primary care provider can be any of those above. You can click on the circles if you want to learn more about nurse practitioners or MDs or PAs or NDs and DOs. I put some links in there if you really want to go and read up about the education and the scope of practice of your primary care provider. You can do that. I'm going to go ahead and skip ahead.
Okay, so before I skip ahead, what I'm going to do is actually click on these for you guys. There are links where you can read about our licensure, our education, everything that you want to know. Picking a primary care provider, as you'll learn later on in the course, it depends on a lot of things. But just so you can know who it is that you got, okay? A nurse practitioner, a primary care physician. Here's a link to PAs. So you can read more about what a physician assistant does in their training, naturopathic doctors, and DOs, doctors of osteopathy. All right, let's keep going.
All right, so again, you see your primary care provider to establish care when you're not feeling well or have a health concern, or for your annual exams, your immunizations and such, and for referrals. All right, by now you've heard me say the term established care a couple of times. So I just want to overview what that means, why you establish care. You do that to establish a relationship with the person that you've selected to be your PCP. So when you make the first visit, it's always kind of funny, right? You call and you say, I need to make an appointment, and they say, what for? What is it for if you're not sick? If it's for a child, well, actually, let me back up. You can say to establish care. And it's kind of important to say that the appointment is to establish care because oftentimes those appointments are a little bit longer. So some people are seeing patients every 15 minutes, while a new patient visit may be 30 minutes. You have a little more time to go over your family history and your habits and who all lives in your home and such. That first visit, it can be for a younger child, a well baby visit or a well child visit. And those are preventative visits that are covered by most insurances. They really help you kind of get an idea of the developmental stage of your child, what they should be able to do, different milestones with language, with motor skills. They test hearing, they test vision. So if you have any concerns about your baby or your child, that can be discussed in that visit. Sports physicals for all of our athletes, whether they're young athletes or collegiate. It's really important that a medical provider listen to your heart, make sure there's no murmurs or anything that could show up later as a serious complication while your athlete is on the court or on the field. Young adults visits are important because they're going to be reviewing things like substance use, like safe sex, all kinds of different things that it's helpful to have somebody besides a parent or a teacher or a coach. Your medical provider is going to be specifically trained to know what things to anticipate for whatever age you are, and that includes middle-aged adults and older adults. Another term for older adult care is gerontology. A lot of older adults may pick internal medicine to be their primary care provider, and those are going to be people who maybe take several different medications or have several chronic diseases, maybe things like cancer or heart failure or diabetes, just different things that require different specialists and maybe more intense care. All right, now we're going to get into the good stuff. If I am talking too much, guys, just know you can click ahead. You don't have to listen to every single word I say. I can get chatty. I apologize. If you're going in for a visit and you've got an issue, a lot of times people don't really know how to prepare for that visit. They don't know what's going to be asked. And it can feel like your provider's just coming in, asking you a couple quick questions, and then leaving. Oftentimes, folks feel like they really didn't get to tell their whole story, that there were some questions that were left unanswered. So, what I'm giving you right now are
Mhm.
some very specific things that are going to happen in that visit, and some specific things that you can think about and maybe even have written down to help get the most out of your medical visit. Again, you're paying a copay and you may even have a bill left over after insurance pays their portion. So I want you to get the most out of your visits as you possibly can. I don't want you walking away with unanswered questions, okay? So if you're coming for a non-urgent medical need, you're gonna wanna know, when did your symptoms start? You know, where is the discomfort located? I often will ask patients to, with one finger, touch the most intense point of their discomfort. You know, we are looking kind of through your body. You know, what organ is underneath that fingertip? What system are they pointing to? So that's one of the tricks that I use. Is the discomfort constant or is it intermittent? You know, do you just notice it after you eat? Is it just when you're lying down to go to sleep? Or is it all the time? That's a really helpful bit of information for us when we're trying to diagnose your issue. Characteristics of discomfort are things like, is it sharp? Is it dull? Is it throbbing? Is it squeezing? Is it itchy? And on and on. You know, when people say it hurts, that can mean so many different things to so many different people. So try to be as specific as possible when you're describing the characteristics of the discomfort. You know, if it's a cough, is it a dry cough? Is it a productive cough? Or are you bringing something up with that cough? Um, you know, if it's pain, is it kind of like a dull nagging ache, or is it intense and sharp? Is it pressure like? Those things really help in the visit. What makes your symptoms better? um, as well as what makes symptoms worse. If you always have discomfort after eating, then that would be the symptom that made it worse, right? But maybe having a bowel movement makes your symptoms better, or standing upright, or positioning yourself a certain way, or if you've already tried treatments at home, you know, maybe you've tried a little ibuprofen, or, you know, our favorite 7 Up. You know, maybe there are some remedies or medications, that over the counter medications that you've tried, that make your symptoms better. Also, very helpful. A focused exam is basically an exam where we are um, just looking at the symptom that you're complaining about. So if it's a cough, you know, that exam may be looking in your mouth, looking at your throat, listening to your lungs, listening, you know, in the front, on the sides, and the back of your lungs, seeing if we can hear different symptoms, or different signs of asthma, or signs of, you know, pneumonia. But we're really probably not going to look at your toes if you're coming in for a cough. So the focused exam is when we do an examination that is just targeting the system that brought you in. Diagnostic tests can be ordered. They will not always be ordered, but they can be ordered. And a diagnostic test is going to be a lab, or a different kind of test, like an x-ray or a scan, or you know, things of that nature. You're not always going to have a diagnostic test ordered. A lot of things can be diagnosed and treated just from your history and the physical exam. Okay. And then follow up. This is probably something that I could hang out and talk about for a long time, but I'm going to be mindful of the time that you are giving to get this information. Follow up is so important. I'm going to tell you guys a trick, okay? Schedule a follow-up appointment, whether you're going to need it or not. I have so many people tell me, I can never get in with my primary care provider. And that's because their next available appointment might be weeks or even months out. So the trick is when you go in, schedule a follow up. If you're going in for an acute issue, schedule follow up for 2 weeks or for a month. And then when it gets close to that time, you can cancel that appointment if you don't need it, but if you're still having an issue, you're going to want to go. You may even be having a new issue. How many times have I made an appointment, and by the time my appointment rolled around, the reason that I scheduled the appointment, that's all cleared up, but I have something new that I want to talk to my provider about. Perfectly fine to do that. Schedule your follow-up. I think when it comes to primary care, you should definitely at least, guys, bare minimum, be seen once a year, but 2 or 3 times a year, every 3 or 4 months is not a bad way to go either. So that's what's going to happen in your visit.
I'm over here. This is so fun. I didn't realize that you guys could see me. So I'm talking to friends and family who are watching this. Don't even mind me up here in this little corner. I thought I had myself minimized. This is such great information. I am going to edit this down so that I can replay it or you can share the link in the future. So please just ignore me over here and enjoy the class. These questions right here, you guys, you should have a notebook and have these questions in it and answer these questions anytime you're going in to see your clinician for an acute visit. I promise it's gold to us. We will be so happy and you will feel like you got more out of your appointment than you have in a very long time.
All right, so speaking of your annual visit, I want to give you an idea of what to expect in an annual or a wellness visit because these visits are different than your regular. Oftentimes, we'll call it an acute visit when you have a problem right now. And the reason that they're different is because they have nothing to do with being sick right now today. It's all about anticipatory guidance, knowing, thinking about what's coming up and preventing potential pitfalls. So we talk about things like social history. Social history is like, are you married, single, divorced, widowed? Who lives in the house with you? Things of that nature. Your work and school history. Are you working? Are you retired? Are you a student? Are you a student with 2 jobs? Are you working 2 jobs? Different things of that nature to give us an idea of who is the whole person that we're treating. Your household, in my house, it's my mom, my husband, and 2 of our 3 kids, and a lot of dogs. We won't go there. But, it's really important for me to know things like that because if I have an 89-year-old patient and they have the number of dogs that I have, I'm thinking about fall risk. I'm thinking about different things like that. So some questions might get kind of funny or seem really personal, but there's always a method to our madness. Habits are things like exercise. Do you exercise? If so, what kind of exercise and how much are you getting? What kind of food do you like to eat? What kind of food is cooked in the home? How much, access to healthy food do you have? Do you smoke? Do you smoke marijuana? Do you vape? Do you drink alcohol? If so, how much? Again, these are questions that can seem really nosy, but we know what kinds of things are more prone to happen to people who smoke or drink or use recreational drugs. So when we're asking those questions, it's not to be judgmental, it's to really help develop that plan of care. Immunizations. Be expected to be asked about immunizations at an annual visit or a wellness visit, whether it's a well baby, well child, or just your own preventative care visit. I know immunizations is a touchy subject and it can be handled by simply telling your care provider whether or not you immunize. And then understand with your immunizations, there should be something given to you, a sheet, a little single sheet of paper that talks about the immunization, what it protects you from, and what kind of side effects maybe to expect from it. It's not uncommon for people to get a little bit of a low grade fever or have a little reaction right at the site. But then there's other things that we want to know if they happen to you and know right away. And all that's going to be included on the information sheet about the immunization. And whether you get the vaccine that day or just want to take the sheet, read up on it, and come back for it later in a medical assistant visit or a nurse visit, is totally fine and up to you. Those are all fair things for you to say. And if you don't immunize at all, if it's just not something that you're at a place where you understand the benefit or are comfortable doing, then you can expect it to be brought up at your annual visit or your wellness visit, and then you can share your views with your healthcare provider. Screening tests, vision, hearing. They may ask you, do you have a dentist? And who is your dentist? How often are you seeing them? Screening tests can also include other diagnostics like an ultrasound if you're of a certain age to look at your aorta. It might include a colonoscopy if you're of a certain age to look at your intestines. It can include a mammogram, different screening tests that we know are part of preventative medicine so that we can catch things, screen for things, and catch them and treat them early if they're present. And all of this together gives you a customized plan of care. It's personal and it's for you. If you never make a wellness visit, if you never see your primary care provider for an annual visit, you're always going to be dealing with surface problems, surface issues, um, acute illnesses, and you're never going to really get to the meat of that relationship, which is your customized plan of care. So this is going to be established at your establishing care visit, and then at your annual visit, your annual checkup when you're not sick. I hope that made sense. If it didn't, I hope that you will send me some comments or questions that you have. I'd love to clarify this, as again, it really is a cornerstone to your healthcare, you know. And it's how we find things before they're, late stage and terminal. It's how we find things and treat things, and help you to maintain health. Okay, done. Sorry.
Kind of done, because I'm going to interject one more thing, and this is about habits. Habits, we also ask because we can aid in helping you stop smoking and helping you stop drinking. We can connect you to chemical dependency counselors and therapies. So, truly, partners in healthcare. Okay, really done, done.
Guys, I'm really having so much fun right now. I love talking about primary care and sharing this kind of information with people. Thanks for bearing with me. We're going to move into referrals or specialty care. Now, remember a few slides back, I said you may at some point in time develop a problem that is beyond the scope of your primary care provider. Well, if that happens, you will need a referral to a specialist. And the reason that you would need that is to get an expert opinion. I want to just pause right there because some people might be like, well, you're a nurse practitioner or my PCP is a doctor. How come they don't know about such and such? Listen, I told you I work in cardiology during the day, right? So for my day job, I am immersed in cardiac issues. I listen to dozens of hearts. I look at dozens of echo reports. I listen to dozens of people who have cardiac specific complaints, and I know what looks a certain way and what sounds a certain way. And that's because I'm immersed in that world. Okay. So your primary care provider, they're seeing 2 months old. They're seeing 90-year-olds. They're seeing people with broken bones. They're seeing people who are being diagnosed with diabetes. They're seeing people of all ages with all different things. And so they really don't get the opportunity to focus on one system and become an expert in that system. And so when you come to them and you have a problem and they've done their due diligence and haven't been able to figure that out, they may refer you out to a specialist who lives in that world. Um, I get together with nurse practitioner friends, and it's so funny. We bounce stuff off of each other and we'll say different things. And there'll be times when they have been pulling their hair out and mulling over something, and just waiting for us to have our time together. And then we're like, oh, yeah, just do da 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 da. Yeah, we say it all the time, da 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 da. And that's because we are in different worlds. So you want to go to the person who's the expert on your issue. And your primary care provider will get the ball rolling. They may order the first round of tests. But if they can't get your symptoms to go away, they're probably going to forward you on to a specialist. Or if you have a diagnosis like cancer or heart failure or insulin dependent diabetes, kidney failure, they may want you to see that specialist at least annually just to make sure that everybody's on the same page. Okay. When you get a referral to a specialist, if you have insurance, they're probably going to only approve it for a certain duration. So they may say 3 visits and the approval expires in 6 months. You want to make sure you schedule and use those visits within that duration period. And then if you need more visits, that can be handled later. But just know, just because you got a referral to an endocrinologist 2 years ago, doesn't mean you can call today and make that appointment. You're going to have to start over with the approval process, which is going to your primary care provider and getting that referral. I wanted to briefly touch on insurance networks. A lot of times your insurance will tell you who you can go to and who you can't go to. I just dealt with this myself. I had a referral and I wanted to see somebody that I knew that I've been working with for many, many years and I felt comfortable with. And then when I got the letter from my insurance, they said, oh no, boo, you need to go over here because this is who is in our network. Everything turned out fine. The other person that I saw was great as well. But I do want to let you all know that just because you have somebody in mind or your grandmother sees this person or your girlfriend sees that person doesn't necessarily mean you're going to be approved to see the same provider. But don't let that get you down. Like I said, everything turned out well for me. It was maybe a little nerve-wracking new person, but an expert nonetheless. Now, if you do not have insurance and you need care from a specialist, it gets really tricky. You may actually have to private pay or pay out of your pocket. Hopefully, you have an account set up to cover healthcare costs and you can pull from that. If not, I'll be the first to tell you right up front, specialists cost more money and you may have to call ahead, let them know your private pay. They may require a down payment. I saw a neurologist, was it neurospinal, a neurosurgeon. Yeah, I wanted to consult with a neurosurgeon about a problem that I was having. And it was my personal desire to see this specific person, and they weren't approved through my insurance. And I don't even know if my problem warranted the referral from my primary care provider. But I called the specialist directly and I said, hey, this is who I want to see. This is what I want to talk to him about. All my films are here, but I'm going to be private pay. I'm going to have to pay out of pocket. I'm not going to lie, it was a pretty penny. It was a pretty penny, but I'm really glad that I had that appointment with that person because they really cleared up a lot of things that I was wondering about. Because again, they were an expert. Information sharing. Okay, guys, there's something called continuity of care. And what that basically means is that everybody's on the same page. You didn't go over here and talk to your gynecologist and then come back to your primary care provider, and your primary care provider doesn't know what's going on. Your gynecologist or whatever specialist that you see is probably going to CC, i.e., carbon copy, which is really probably a term that people don't really, younger people may not even know what a carbon copy is. Lord have mercy. Well, anyway, they're going to send the notes from that visit to your PCP so that everybody can be on the same page, okay? I put this out there because I've certainly had people in the past say, I don't know how this information got back to so-and-so when I had this conversation with this specialist, because it is a network. We are talking about you to provide the best care to you. The right hand needs to know what the left hand is doing. They need to know what medications are being prescribed so that they don't, prescribe something that is, not compatible. It's really about your safety and making sure that, the information flows from person to person like it should. Everything's not perfect all the time. Sometimes the memo doesn't go through. So take a card from your primary care provider. It's kind of cool to have everybody's cards anyway, because you never know when you're going to be at an appointment and they're going to say, well, what's their fax number? And you're like, how the heck am I supposed to know? It's right there on the card. So if you don't have their card, go into your smartphone, whatever. But it's very helpful to leave that information with your specialist. And some places may even require that you fill out a release of information. So I wanted to make sure that you know that your information will likely be shared. Following up after specialty care, you want to clarify that with the specialist. When do you want to see me again? Do I need to come back? Am I to follow up with you or with my PCP? Follow-up is very important to clarify with specialty care, and they should be able to tell you what's next so that you know what to expect as well. All right, so that's it on specialty care. Moving on.
Moving on. What's up next? Ooh, let's see. Gotta find it. Let's go.
Well, all this is well and good, isn't it? But how do you even find somebody? How do you access primary care? Well, the first thing I always tell people is ask around, ask your friends and family. Hey, do you have a primary care provider? You got a PCP? You got a nurse practitioner? You go to a doctor and ask them if they like them, if they think they'd be a good fit for you. You can find out who's taking new patients if there's a clinic close to your home or close to your job or at your school. Just to find out, call that clinic and ask if somebody's taking new patients. A lot of times you can read their bio, see if you're a good fit or not, and make an appointment. When it comes down to changing providers, like say you are with somebody that you just really don't click with and you really don't feel like you can be honest with, you're going to want to change providers. And to do that, find a new provider and fill out a release of information for your old provider. That way they'll get all the information, all the tests and whatnot that were done at your previous provider, so you don't have to start over from scratch. Let's talk about insurance and how you can find care with or without it.
It's my cue to quit texting and pay attention to my own class. Listen, it's long for me. So if it's long for you, just come back when you can. There will be a replay. I will absolutely edit this and replay this course. Okay. So if you have to step away, don't feel bad. It happens. People have to use the restroom. They have to drink water. They have to eat an orange. Okay. Let's go.
If you have insurance, affordable insurance, insurance is provided through your job. If you have health insurance, I want you to pause the class right now and do a little happy dance, because you are certainly privileged if you have medical insurance. It makes things so much easier,
Yes, I
and
love
it
it.
costs you a lot less money should you have a problem. Okay, now that you're done doing your happy dance, if you have insurance, what you're going to want to do is call the customer service number on your insurance card. Let them know you're looking for a primary care provider. They should be able to help you. You can also go to your insurer's website and fill out the profile. Those profiles are pretty cool, actually. They'll send you little health reminders in the mail. A lot of different insurance companies offer different incentives or different, fun courses, challenges, things you can do. I actually worked for one place where you got a Fitbit if you just got your blood drawn and your blood pressure taken. Like, you know, you got a free Fitbit. So that was cool. Um, but anyway, you can call clinics and find out if they take your insurance. Insurance certainly makes things easier, but do not fret if you do not have it. There are other options.
Hmm. What other options, Devin?
So first I want to talk about people who are underinsured. Maybe some of you didn't want to do the happy dance on the last slide because you got insurance, but you got a $2,500 deductible. What good does that do you if you don't use $2,500 worth of healthcare expenses in a calendar year? Well, I want to give you some other options. Do not fret. There are high deductible health plans available. You may want to speak with your employer. Well, you will want to speak with your benefits specialist at your employer and find out if you have access to flexible spending accounts or health savings accounts. I'll leave a little link there where you can read about what those are, but it's basically pre-tax money that gets put into an account so that when you have a healthcare need, you can use that money for that healthcare need. One hospital I worked for actually gave us a little card, like a debit card. So if you were picking up prescriptions from the pharmacy and they cost you, $17, you swipe that card, boom, boom, one and done. It was actually pretty cool. So those are a couple of options. Same day clinics and walk-in clinics can be helpful if you have a high deductible plan. The way that they can be helpful is they're going to be cheaper than an emergency room visit. Y'all, I have insurance and my copay for an emergency room visit is still $300. So to step foot in an emergency room and be seen for any reason is going to cost me a minimum of $300 with my insurance. But if you go to a walk-in clinic or a same day clinic, that cost could be significantly cut or brought down. Direct pay is one of my favorite things that's happening right now. I've got a nice little network of women that I have met, nurse practitioners who have direct pay clinics. And the way direct pay clinic works is a lot of times you pay a small fee a month. Maybe for your whole family, it's like $115. Think about that for a second. If your insurance premium is $550 a month and y'all never go to, you never get sick, you really only go once a year for your wellness visits, and that's that, maybe a sports physical. Think about direct pay because you can pay significantly less money a month to have someone available to you to take care of those issues and other issues should they arise. So you can look like Google direct pay in your city, direct pay clinic in your city. A lot of the guests that I've had on the Purpose Stethoscope podcast have been owners of operators of direct pay clinics. Pretty cool option. It's kind of newer, so you may not have heard about it. That's why I wanted to mention it here. Another option that can be very handy is a virtual visit. This is when you this is when you connect or contact or connect with a medical provider through your phone, through your computer. It may be a telephone call. It may be a special app that you message back and forth. It could be a video visit. But it's really handy for people who work odd hours and are never available during clinic hours or have trouble taking time off of work. I think virtual visits work well for kind of one-off things and, maybe things where you have a primary care provider and you just need maybe a medication refill or some labs done, and you're not going to be able to get in for several months. It's really great for that. And it's a really nice adjunct that a lot of people and clinics have to their clinic. So the medical system that I work for, we actually have an e-clinic so that our patients, if they're having an issue and they can't get into urgent care, they can't get into the primary care provider, they can talk to a provider through a video visit, which is actually pretty cool. A lot of times these will cost less than going into an emergency room, and it's just great for folks who are underinsured. So I want to make sure to mention that. And on we go to uninsured.
We're all learning about virtual visits right now during this COVID crisis, aren't we? Let's keep going. Maybe I didn't voice over on this one. So hopefully you guys can hear me okay. This slide simply says no insurance, no problem. There are free clinics out there. There are clinics that will see you based on your income. If you have no income, you pay nothing. If you have limited income, you pay a percentage of your income, or they decide based on a sliding scale how much it's going to cost you. You can go to freeclinics.com to look for a free clinic in your area. Community health centers is something else you may want to Google, community health center and your city's name. They tend to offer services, a breadth of services, dentistry, mental health, physical health, for lower prices. Urgent care is an option. Urgent care is a cheaper option than ER. And I would venture to say that a good percentage of what shows up in the ER could probably have been seen at urgent care. So be sure, if you have to go in right now and see somebody today, make sure that you might want to look and see if there's an urgent care in your area that can accommodate your need at a lower price than what the ER would cost. Now, the ER is the ER for a reason. If you're having an emergency, you need to be seen right away. You may have dialed 911, that's where they're going to take you. Emergency rooms are appropriate for emergencies, bleeding, shortness of breath, chest pain, car accidents, these type of things that are, you can't wait until tomorrow to be seen. Then you want to use your ER. Note, a lot of hospitals have charity programs. They have payment plans that you can get on. So don't let the cost of the care prevent you from getting life-saving care. Go, you get the care, you worry about the cost of it later, call the billing department, ask about an application for charity or to be put on a payment plan of some sort.
That concludes the Divinity Health and Wellness Primary Care course. Again, I think this will probably always be the most important course that I ever put out, because primary care saves lives. We catch things early, we help people stay healthy, and it's just really important that we have that relationship. Every new year, people are making resolutions to lose weight and feel great. And, those are great things. It's really good to have goals in mind, but it's even better to have somebody to walk it out with you. I recently actually have started working with a financial planner because I don't know everything there is to know about money. I've got good goals, I've got a budget, but at the end of the day, I want to make sure that I'm getting the most bang for my buck, that I'm maximizing my benefits, that my investments are performing well. And I didn't go to school to study finances. I went to school to study nursing. So I'm not an expert in that. So, I say all this to say, when it comes to your health, you live in your body. You know you better than anybody. And it's always going to be important to find a PCP that you fit well with, that you can be honest with, that you can talk to, that you feel like listens to you. And on that same token, You want to work with an experienced professional. There's so much online. I mean, you Google your symptoms, you're going to end up dead or taking a whole bunch of herbs and oils and other things. And I'm not knocking that stuff,
Not at all.
but I will say, just like medications have adverse effects and interactions, that can happen too with natural medicine, with teas and herbs and different tinctures that you can buy in the stores. So you really want to find someone who's going to work with you to give yourself the best quality of life with regards to your health. That's why I'm here. That's why so many other medical providers are out there. And I really hope that this course helped you to understand why you need primary care, how to find primary care, and how to access it and navigate it. Thank you so much for giving me this much of your time. You can find me at D the NP on all social media. My website's dthenp.org or divinityhealthandwellness.org. And my YouTube, of course, you can leave me comments and questions and let me know what it is that you guys want to learn about. What kind of classes should I put out? What kind of topics are you interested in learning about? What kind of guests would you like to hear on the podcast, by the way, which is called The Purple Stethoscope, also available on YouTube, Apple Podcasts, Spotify, all that stuff. Thanks again. And share it with your friends and family so that they can understand how to access and navigate primary care too. Bye.
Wow, you guys. So that was my primary care class that I recorded way back in January. I'm grateful for this time to figure out some of the technological stuff so that I can get this content out to you all. Thanks again for watching. Let me know in the comments what questions you had about the course. Let me know what things you would like to talk about in the future. I hope you're staying healthy and staying well. Um, and thanks again for giving me some of your time today to learn something that's very vital, very important, and that will help us close the health disparity gap. Until then, until next time, eat fresh and dance. Bye.